You are listening to Labor Pains, an injured worker podcast featuring conversations in workers' compensation and health and safety in Ontario, Canada, and beyond. Labor Pains is produced by Injured Workers Community Legal Clinic and is not a substitute for legal advice. For more information on workers' compensation issues, campaigns, and resources, visit injuredworkersonline.org. Today's episode is hosted by Tabassum Durrani, a lawyer at Injured Workers Community Legal Aid Clinic.
On today's episode, we're looking at a proposal that could change how millions of people access prescription medication in Ontario. We're delving into a motion to expand the Ontario Drug Benefit Program to cover everyone universally. Currently, the Ontario Drug Benefit Program provides coverage for certain groups, including seniors or people on social assistance. But a motion brought forward by the Ontario NDP this past summer is challenging that model, arguing that drug coverage should be universal, not tied to age, income, or employment status. For injured workers, the stakes around this issue are particularly high. Many lose access to workplace or private drug plans after an injury or layoff, leaving them to shoulder the cost of medications they depend on for recovery and long-term health. According to WSIB policy, employer-provided benefits only have to be provided 1 year following an injury. And the WSIB does not cover medications for non-compensable conditions. Now, a universal drug program in Ontario could close those gaps, ensuring that no one goes without essential prescriptions because of their employment status or because of an injury on the job. Critics, however, raise concerns about the cost of such an expanded drug benefit program and the potential overlap with existing insurance systems. Supporters, though, counter that universal coverage could ultimately save money through better overall health outcomes. Now, to unpack what this proposal could mean and what it might look like, we sat down with Dr. Robin Lennox, a member of Provincial Parliament with the Ontario NDP for the riding of Hamilton Centre. She's also a physician and was the sponsor of the motion. We discussed the vision behind the motion, its potential impact on workers, and the broader debate over how Ontario funds access to medication. Hi, Robin. Thanks for joining me.
Thank you so much for having me.
I wonder if you can just start by setting the scene for us a bit and explaining what the Ontario Drug Benefit Program currently covers, and then what gaps that you see in it that prompted you to introduce your motion a few months ago for expanded coverage.
Absolutely. So Ontario Drug Benefit basically refers to the amount of publicly covered drugs and medicines that we have in Ontario right now. It doesn't include every single drug, but it includes, thousands of our most commonly used medicines, things like for blood pressure, diabetes, contraception, mental health, the vast majority of the essential medications that we would consider for most of the illnesses that people would have are included on that Ontario Drug Benefit. And right now, the people who can access the Ontario Drug Benefit generally fall into 4 groups. So you either have to be under the age of 26, so that would be OHIP plus. You have to be over the age of 65. So that's to cover, basically everyone from 65 sort of onwards. Or you are living in long-term care, or you are on social assistance like Ontario Works or Ontario Disability Support Program. And so for those folks, the medications are covered. They're able to access any medication that's on the Ontario Drug Benefit formulary. But there's a huge number of people who are left out of that. So basically anyone from 26 to 64, if you are not on social assistance and you don't have private health benefits through your employer, then you don't have any medication coverage. And so for those people, when you think about that, that's a huge chunk of our life. Any health condition you get in that time, even simple things like antibiotics for pneumonia, if you need to be on a mental health medication for a year or more, if you want to be on birth control, all of those things are essentially coming out of your pocket. And it's a huge financial burden for many people in Ontario.
So as I mentioned before, you brought a motion at Queen's Park in May. And I'm wondering, from your perspective, was that motion a response to specific stories or scenarios that you were hearing from your constituents?
I would say so. Prior to becoming elected, I worked as a family doctor. And so I would say most of the motivation for it was just, over the many years that I've been in practice, seeing people come into my family practice, having the visits, which are covered, by the way, the doctor's visits are covered, looking at their blood work, which is also covered, seeing, markers of disease or illness, and then, having the one thing that could actually keep them well and they're not able to access it. So I would have people sitting in my clinic with me saying, I know I'm supposed to be taking this or that medication, but I just can't afford it. And then we'd be in the position of trying to scramble to find, samples or programs through drug companies that they could access. But there were a lot of people who were working full time, but who were struggling, like paycheck to paycheck. And that couple $100s to get their medication every month just wasn't feasible. And their health deteriorated. And so I think it was really from those stories and just witnessing the impact of the absence of pharmacare, year after year in practice, sitting across from people. That was really the impetus for this was, what is something that I can do that sort of brings together my clinical work and my political work in a way that would, hopefully improve the health of a lot of people in the province.
Right. I want to just shift a little bit to speak to our particular constituents at our legal clinic, which is injured workers. And given your clinical background, I think you would be really well placed to speak to these questions and concerns that I think come up from our clients a lot. So from your perspective, what difference would expanded coverage as you have envisioned and proposed would make for someone who is living with the long-term effects of a workplace injury, so both physically and emotionally?
Yeah, so, as you know, right, many injured workers, if it's related to their specific condition, their work injury, they would have some medication coverage through WSIB. But that doesn't account for anything else that they might, experience or develop in that time. So if they develop any other conditions, any other, illnesses in that time, if it's not related to that initial work injury, then it's not covered. And so then they're left to pay out of pocket. And we know that most people who are injured workers are not given enough financial support as it is, let alone trying to find money for medications. So there's that one component where it would broaden the amount of medication coverage that they have so they're covered for any condition they develop. The other thing I always think about is, there are a lot of workers who are going to work right now who have private health benefits tied to their employer, who might not feel safe in their workplace, right? Who might be doing work that puts them at risk of injury or disability, but who feel like they can't lose those health benefits. Maybe they have an underlying condition. Maybe their family member has an underlying condition and they're the one bringing the benefits into that home. So it would also give workers the peace of mind that your employer does not hold your health benefits. Your health benefits are public. And so then that gives you freedom to leave that employer if you feel like they're not looking out for your safety. If you feel like you have to choose between going to an unsafe work environment and picking up your, partner's medication, you don't have to make that impossible decision. You could be more mobile. So those are the two ways where I think it would really free up workers and particularly help for both, injured workers and workers at risk of injury at work.
Right. I think you've kind of answered my next question, but I also wanted your thoughts on, the overall lack of access to medication and how that can actually worsen somebody's injury and just overall all well-being.
Totally. So you can only imagine, like, if someone if someone has an underlying medical condition and they're not getting treated for it, likely that medical condition is going to get worse. Their physical health is going to get worse. Maybe their mental health is going to get worse. And when we're not feeling our best, that's when we're vulnerable to mistakes on the job, accidents on the job, injury. So it also increases that risk. I think about folks with diabetes, for example. And one of the complications of diabetes when it's not treated is that you can start to lose feeling in, your fingers or your toes or your feet. And so if you're in a safety sensitive position and, you're starting to get numbness in your feet, your hands, your grip isn't the same. That's going to put you at increased risk of injury. And it's directly tied to the fact that you're not able to access the treatment that you needed to be able to stay well. beyond the fact that, we're not just meant to be cogs in a wheel and we're not about what we can produce, but it's also about the quality of life outside of work, right? You should be able, if you're working full time, you should be able to afford groceries, afford rent, and afford medications, right? Those are essential things that we need to stay well and live well. And if that's not happening, in my mind, that's a governance failure.
I'm sure you've had to field this question. What would you say to critics who would argue that, well, Ontario can't really afford this type of an expansion right now?
Yes, it's my favorite question because I get to say that we can't afford not to. Because right now, we have huge health system costs that are being driven by medication non-adherence, cost-related medication non-adherence, meaning that when you're not getting treated for your medical condition, oftentimes we see people ending up in the emergency department, which is very costly, ending up in hospital, which is very costly, or even sometimes getting surgeries that could have been prevented had someone had the right treatment early on with medication. And so we see a huge burden of cost to our hospital and our healthcare system because, again, all of those things are covered, right? Those are all coming out of the public purse. And so when we actually look at the numbers, if we were to expand access to essential medications for all Ontarians, so everyone with a health card, we would have to invest 1.3 billion, but the estimated savings to the health system are 2.1 million. So we're actually saving more money than we're paying. It's an upfront investment, but then you save money while also improving people's health. So, those opportunities where we can actually be more fiscally responsible and take better care of people, I can't understand why we wouldn't grab onto those opportunities and make it happen.
So you introduced this motion back in May, and it didn't pass at Queen's Park. So what would you say? Do you think that there's political will to move forward with this, or would you say that your motion was maybe more about starting that conversation? Where do you read kind of the political winds on this?
Yeah, so the effort for pharmacare has been going on for decades, across the country and within Ontario. There are a lot of organizations advocating for it. And the thing that is really remarkable is that it's actually one of the things that the vast majority of Canadians support. So 85% of Canadians, when surveyed, support publicly funded pharmacare. It really feels like a no-brainer. There are very few issues where we have that level of consistent public support across the country, particularly now. And I will say, we did get the support of, obviously the entire NDP caucus, of which I'm a member, the Liberal caucus, the Green Party. It was really only the Conservative Party that voted against it. And I think it's just a matter of their priorities and who they have the interest in mind. And what it comes down to is really protecting private insurance, private health benefit companies. Because even right now on the table, separate from my motion, which was Ontario specific, right now we saw the Federal Pharmacare Act pass last year at the federal government level, which would provide coverage for contraception and diabetes medications and supplies. There are other provinces that have, entered into a funding agreement with the federal government to offer free contraception and diabetes medications. That's billions of dollars on the table. Ontario has yet to sign on to that. So the Ford government has yet to say, yes, we will take that opportunity and give people free access to diabetes medications and contraception. And when we've reached out to the Minister of Health to say, why aren't we acting on this offer? Why aren't we taking this money, which could go to expanding access to medication for people? And their sole response is that they need to figure out how it will work with private health benefits, which is really just protecting profits for private health benefit companies. And those are not the people I'm concerned about. I'm concerned about people who can't afford their medication right now getting access to it. That to me is not a defensible reason why we should be leaving money for free medication on the table.
So what does this motion mean, not just for injured workers, but for I guess, the idea of healthcare as a right and not a privilege.
Exactly. It realizes sort of what the true vision of Medicare was supposed to be in Canada. Medicare was never supposed to just be limited to physician or hospital services. It was supposed to mean that any service that you needed to be able to support your health, to keep you in good health, those are things that we believe should be universally covered for everybody, that everybody should have access to it, that access should be the same, whether in a rural community, an urban community, no matter how much you make, no matter how much, whether you're employed or not, what your age is. It's really just about realizing that promise and following through on what the vision for, universal healthcare really is.
What's next for this motion, and how can people get either more involved or more information about it?
Yeah, so the thing is that I've learned, or that I'm learning, being new to this role, is that you need persistence to be able to get legislation passed. You need persistence. So I'm not necessarily discouraged by the fact that the motion didn't pass. I'm actually quite encouraged by the fact that we got, every other party support other than the Conservatives. I think we just need to make sure that this is something that everyday people are aware of, as this is a possibility. We could have this system. This isn't out of our reach. This isn't a wild, outlandish idea. We're actually the only high-income country in the world that has a universal healthcare system that doesn't have a requisite universal pharmacare program. We're an outlier. So this is very achievable. And I think the more people know that, and the more people know to demand that of their elected officials, I think we can build a groundswell of support. And then, ultimately, every elected official at some point is going to need to be reelected, or hope to be reelected. And if this becomes something that their constituents are demanding of them, I do think that is a good vehicle for change.
So are there plans for you to try and reintroduce something in the future?
Yes. So this month, one of the things that we're working on is really trying to get the Ontario government to commit to signing on to the Federal Pharmacare Act as a starting point for the contraception and diabetes medication coverage, because we want to make sure that we're signing on to that before something changes at the federal level, and maybe that offer isn't on the table forever. So that's sort of the immediate focus right now, because there is some time urgency, and we know that other provinces have already signed on and are putting those programs in place. So that's happening right now. We do have petitions going where people can, sign on to voice their support. We're working with a lot of great organizations like Canadian Doctors for Medicare to try to, link up with their advocacy efforts. And then, so my hope is over the spring session and moving forward to put forward legislation that sort of mirrors the motion that I put in previously, but continues to push for this as a priority.
So lastly, just to end on this note, for those that are listening who may be struggling to afford their prescriptions right now, what message would you want them to hear?
I think the main thing I would want them to hear is that, we see your struggle. It's not your fault. This is a government responsibility, and that, we can do better, and you should be able to expect better from your government. And that I truly believe this will be something that will come to pass eventually. I think it's just about building the momentum to get there.
Great. Well, thank you so much. I really appreciate the time you took to speak with me today.
I really appreciate it.
You have been listening to Labor Pains, an Injured Worker podcast, produced by Injured Workers Community Legal Aid Clinic. Labor Pains is not a substitute for legal advice. For more information on workers' compensation issues, campaigns, and resources, visit injuredworkersonline.org.